the amount of change that's going to go on in the hospital in the acute care setting over the next 5 years could be as much as we've seen over the last 20 to 30.
Oh, I absolutely agree. I'm a pediatric critical care physician by training, so data is important. Having a sense of the physiologic status of every patient is important. And again, going back to our burnout issue, I think our areas that are the most tapped right now are our acute care floors and our emergency department. And my hypothesis is part of it is because they have the least access to information that tells them that their patient's okay. And so we are actually looking at wearable monitors, and we're hopefully in the next 4 to 6 weeks doing a pilot. As most large health centers have, our emergency department is oversubscribed. We have named beds in the hallways, gurneys all lined up because that's where the patients will go, and waiting at times 4 to 6 to 8 hours. And unfortunately, those beds were not designed to have a monitor. And so we're working with a company called Masimo to see if we can leverage some of their wireless non-tethered monitors that's attached to the patient, but doesn't have all the wires and need the power and runs on battery, and that can transmit and distribute that data to places where clinicians can have access to it without having to walk up to the bedside. And our hope is then to see maybe even patients in the waiting room who can't even get a physical site can still have a level of monitoring. And I think those types of things are going to become more ubiquitous because the price of technology and the capabilities have so markedly improved in the past 5 years.